Hello all. Today we'll be discussing about airway assessment and management. The objective of this course is we have to able to describe the ABCD approach. We have to describe also the technique of airway opening, what the cause of airway of obstructions. So how we manage if airway obstructs. This is the objective of this course. Managing airway is a fundamental skill for medical professions. It is a cornerstone during resuscitation also. What's ABCD? ABCD is an acronym. It stands for A is for airway, B is for breathing, C is for circulation, D is for disability, or if there is a neurological deficit, and E is exposure if the patient have some problem on the back or another. So we have to expose, we have to look at. What's the purpose of this ABCD? One of the purposes of ABCD is because it is a systematic way. It provides life-saving treatment. It helps us to break down complex clinical situation into more manageable parts. It serves as an assessment and a treatment algorithm, and also to obtain a time to establish a final diagnosis and treatment. So how we assess airway? How we assess airway? We have to ask 3 questions ourselves during assessing airway. One, is patient can speak? If the patient speak, that means airway is patent. If cannot, it's not. The second question is airway obstructed or not? So we have to look for sign of airway obstruction. The third question is patient can breathe? We have to ask if the patient is not breathing, there's a problem on the airway. So we have to ask these 3 questions ourselves. And that is, what's the cause of airway obstruction? There are a lot of causes that can cause airway obstruction. One, if tank back filling, the airway can be obstructed. The another is due to the secretions, due to the infection, bacterial infection, viral infection. If swelling, the another is due to swelling. If anaphylaxis reactions, trauma to the face or neck can obstruct the airway. The burn, particularly inhalation injury, can obstruct the airway. So if airway obstructions, how we manage that? Particularly if tank filling back, how we manage that? There are 2 methods in which, or 2 maneuvers in which we're opening airway. The first one is, we call that chill lift, and the heel tilt is one of the maneuver. This is we use in non-trauma patients. We have to tilt our heads, and we have to lifting chill. Then that is help us to open airway. The another is in trauma patients. If particularly suspect spinal injury, we use Jotar's maneuver. That is pushing upward mandible angles, and then forward. By making this, we have to open airway. So this is all about. This is really important, particularly during resuscitation, to save the life of the patient. Thank you very much for today.